Transplant coronary artery disease, also known as cardiac allograft vasculopathy, is a unique and aggressive form of coronary artery disease that occurs in the transplanted heart. It remains the leading cause of late graft failure and death in heart transplant recipients. Unlike standard coronary artery disease with atherosclerosis, which typically presents as focal eccentric plaques, transplant coronary artery disease is characterized by concentric diffuse intimal thickening that often involves the entire length of both epicardial and intramyocardial vessels. As the transplanted heart is denervated, the nerves were severed during surgery, patients typically do not feel angina or chest pain. Symptoms, if they occur, are often non-specific, such as unusual fatigue or shortness of breath, nausea or stomach discomfort. They may also present with sudden heart failure, arrhythmias, sudden death, or silent myocardial infarction. Severe diastolic dysfunction with normal left ventricular ejection fraction can occur due to microvasculopathy or small vessel disease. Pathology is primarily due to an immunological phenomenon. Recipient's immune system causes chronic injury to the donor heart's endothelium. This triggers a reparative process where smooth muscle cells and fibroblasts proliferate, gradually narrowing the vessel lumen. Risk factors: immunologic, HLA mismatch, frequency of acute rejection episodes, and cytomegalovirus infection. Non-immunologic: older donor age, hypertension, diabetes, and dyslipidemia. Standard coronary angiography often underestimates the severity of transplant coronary artery disease because the narrowing is so uniform. Intravascular ultrasound, or IVUS, is considered the most sensitive tool for early detection. It can measure the actual thickness of the arterial wall. The International Society for Heart and Lung Transplantation classifies CAV into 4 grades based on angiography. Here's a simplified description for ease of remembering. CAV 0, there is no detectable cardiac allograft vasculopathy. CAV 1, mild, left main stenosis less than 50%.